This is a case of a very complex internal carotid artery aneurysm treated by both stents as well as open surgery. This 9-year-old who was worked up for a cardiac murmur had a left internal carotid artery aneurysm discovered incidentally. It is clearly a dissecting aneurysm, relatively long, and the AP and lateral angiogram demonstrates the extent of the carotid artery involvement. The patient underwent treatment with a pipeline at an outside institution. The aneurysm continued to fill, and subsequently a total of 7 pipeline stents were placed, with the unfortunate side effect of continued filling of the aneurysm and progressive visual loss. Although the initial angiograms demonstrated beautiful absence of aneurysmal filling in the early phase, it did demonstrate rather significant middle cerebral artery stenosis at the end of the stents. But during the later phases of the angiogram, despite the 7 stents, one could continue to see progressive filling of the aneurysm. The aneurysm continued to enlarge and caused significant visual deficit, which led to further treatment. The patient underwent an orbitozygomatic approach. The optic nerve was identified and decompressed. The internal carotid artery is visible with the multiple stents inside. And at the end of the stents, one can see the perforators coming off right at the edge of the stent. A superficial temporal artery to middle cerebral artery bypass was performed utilizing interrupted sutures. First the back wall, then the front wall of the bypass was performed. The stitches are placed first and then tied at the end. Following removal of the temporary clips, the pulsating anastomosis is visualized and patency confirmed with indocyanine green. The internal carotid artery is occluded in the neck with partial occlusion to allow some flow through the internal carotid artery and aneurysm to make sure that there was not too much cessation of flow. The postoperative angiogram then showed complete occlusion of the internal carotid artery, with the hemisphere now being dependent on the STA MCA bypass. The patient had no change in his neurological exam and had progressive improvement of his visual symptoms over time.